I'm going to check in on that COVID Safe app in just a moment, but I want to catch up again now with Professor Peter Collignon, infectious diseases expert from ANU, who keeps us up to date weekly. Thanks for joining us again, Peter. Really keen to hear from you, your thoughts on it, as we get all this good news about how we're totally suppressing across the country new infections.
Well, we are being very successful.
Yeah, sorry. So I just wanted your thoughts then on the second wave. How does a second wave occur? In other words, what should we be worried about? How would we lose control of a situation we've obviously got very much under control at the moment?
Well, we've got it under control at the moment. We haven't eliminated it, but we've just got very low cases occurring. And that'll probably continue because this virus, unfortunately, is going to hang around for quite a while and can easily be reintroduced from somewhere else in any case. But when they talk about second waves, it's mainly what happened during the Spanish flu of 1918, 1919. We interestingly had our first wave around the same time as we've had this one. But then in winter, a second wave came that was slightly bigger. Now, do I think that's going to happen? Probably not to any near the same extent. Winter is more of a risk because all respiratory viruses, and this is just another one, transmit more during winter, probably because we're closer together indoors more, maybe something to do with the humidity and temperature. But the difference between this and Spanish flu is we have good testing for it. That's not what they had back in 1918. We've got very high uptake of testing in Australia. It'll probably even go higher. And if the sewage measuring works to find the virus, we'll have a community, a way of telling how much of the virus is there and whether it's going up or not. And we also know how this virus is transmitted, which is basically by our hands and by droplets, and why the 1.5, 2 metre distancing rule is so important. And we can continue to do that. People have been very good. So I think we can control this virus. I think we will see more cases in winter. But I think if we keep on doing what we're doing and don't, if you like, slack off too much, we can make sure it's just a ripple as a second wave rather than a tidal wave.
Yeah, I think you can see it around you, how people will happily keep distance, wash their hands more often, very much more wary of the surfaces around them. So if we keep that going through winter, what do you think about the way we're starting to relax the social restrictions? Are we going too slowly? I know you've been very strong on schools. All the kids should be back at school already. But is it time that people started going back into the workplace and that we started to open up smaller businesses? Are we going fast enough in your belief?
Well, I think what has made the biggest difference, in my view, is what we did from mid-March to late March. And that's what all the premiers and Prime Minister agreed to then, which was not to close up all businesses. It was just to close up certain businesses where people were crowded together indoors. And examples of that were clubs and pubs, restaurants, but also churches and other places like that, and making sure weddings didn't have more than 10 people or 5 or 10 people, and the same for funerals. Now, all of those we can look at as maybe relaxing a bit, but I think all of those are going to have to stay in place probably at least till the end of winter to a degree, maybe a bit more relaxed. But if you look at what Victoria's done and maybe New South Wales, that's quite different to South Australia. South Australia has kept really what was agreed from mid to late March. And the New Zealand approach hasn't been more successful for Australia by locking people up altogether. So I think we need to learn what level of restriction do we need that, yes, stops the virus from transmitting. And we've done a lot of things that have been very successful, and I might say disruptive to a lot of employment. But you can go almost too far without obvious benefits from those extra restrictions, but a lot of effects on livelihoods, people's, social interactions, and even their sanity if they get cooped up for too long.
Now, one of the things we've talked about for a long while is the evidence of the way children are really spared by this virus to a large degree in terms of infections and in terms of severe symptoms when they do get infected. There are some cases coming out of the UK where they're suggesting there's another condition, respiratory condition, that could be linked, that children are suffering from, that could be linked to COVID-19. What are your thoughts on what we know about that so far?
Well, what I've seen of those reports, it's actually like a condition called Kawasaki disease. It's been around for a long period of time, and it's an inflammation of the blood vessels. And what's interesting about the reports from, at least I've seen from England, a lot of those children haven't had COVID. They've had something else. Some have. So I think we don't actually know the causes of all this. The good news is relatively, look at a country that's had uncontrolled infections like England, and they still only have 20 cases like this. So it still means children under 15 are not getting these infections very often and don't appear to be much involved in transmitting it either. But there's a lot we have to know. One of it is, why aren't children getting it? I mean, it's the opposite to influenza and almost every other virus you can find. And the concern about that is actually for making a vaccine. If children aren't getting it, why not? And has that got some implications for the normal immune response that's different, that we're going to have to learn if we're going to make an effective and safe vaccine?
Precisely. The other area we're doing a lot of work on is drugs. We've talked a lot before about hydroxychloroquine. We won't know a hell of a lot more about that until we get clinical trial results back. But the Americans have made another step forward related to another drug. I don't have its name, but you'll be across it, an Ebola drug that blocks the virus.
Yeah, it's remdesivir, which was developed for Ebola, and there's been trials in China and some trials in the US. Now, what's interesting, it is being promoted, but at least the data I've seen from China that was available in the Lancet over the last 24 hours, unfortunately, it didn't actually have the big effect expecting. It was to look at deaths and did it decrease deaths compared to placebo, and it didn't. There may have been some advantages in people getting slightly, better a bit quicker. But the US, the main data that's come out has actually been in a press release rather than a scientific paper. But again, from what I can tell from that press release, is that no, there weren't a decrease in deaths in the treatment arm versus the placebo arm. There was probably some improvement in how quickly people cleared the virus, maybe 4 or 5 days earlier, so they got out of hospital 4 or 5 days earlier. But the big crunch is actually, does it save people from dying? And both those studies in China and the US didn't really show that, at least not in a statistically significant way. And that's quite different, for instance, when antibiotics first became available. In the 1920s, if you had the golden staph germ in your blood or the pneumonia germ, you had an 80 or 90% chance of dying within 30 days. Antibiotics, penicillin, dropped that down to 10 or 20%. So that's not the effect we're seeing with this drug. Now, there may be some benefits. Maybe it needs to be modified so it has more, it's got at least some hope here. But it's not the breakthrough that we sort of see with antibiotics, for instance, for the first time. So I think we still need to be wary. And what it means is we need to do proper studies with placebo arms before we try and roll this out to millions and millions of people, because this drug hasn't been as successful as people were expecting, at least from the release of data so far from China and the US.